Hello friends, I am Shaurya Mishra. Welcome you to your own YouTube channel, Vision Care Advisor. Friends, in this video, we will discuss about transient loss of vision, causes of transient loss of vision, and the treatment of transient loss of vision if needed. So, without taking much time, let's get started. Friends, transient loss of vision is also called Amaurosis Fugax. It can either be monocular or binocular, but it mostly occurs monocularly. So, we can say that Amaurosis Fugax is a transient. Transient means short time. Amaurosis Fugax is a transient monocular blindness due to temporary lack of blood flow causing hypoxia, either to the brain or to the retina. It is related to atherosclerosis in the blood vessels. Actually, atherosclerosis is a disease in which a plaque begins to form inside your arteries. Arteries carry oxygenated blood to other parts of your heart and body. So, it is related to atherosclerosis in the blood vessels that supply the brain and is thought to be the result of emboli from plaques in the carotid artery. These block an artery for a while and then move on, resulting in a loss of vision for the duration of blockage. It refers to a sudden, temporary, and painless monocular visual loss, and the attack lasts from few seconds to 30 minutes and it recovers completely. The sudden loss may appear like a curtain falling from above or rising from below, and vision may be completely absent at the height of the attack. An attack of Amaurosis Fugax is typically described by the patients as a curtain that descends from above or ascends from below to occupy the upper or lower half of their visual fields. The attack lasts for 2 to 5 minutes and resolves in the reverse pattern of progression, leaving no residual deficit. Due to brief duration of the attack, it is rarely possible to observe the fundus. So let's know the causes of transient loss of vision. During examination or shortly after an attack may reveal retinal ischemia in the form of retinal edema, small hemorrhages, and in some cases visible emboli in the retinal vessels. The emboli are fibrin platelet aggregates originating on the irregular surface of an ulcerating atheroma within the carotid artery or the aorta, or cholesterol crystals. Repeated attacks of Amaurosis Fugax indicate the need for arteriography, especially if associated with transient cerebral systems. Cardiovascular abnormalities such as valvular defects or arrhythmias may cause similar visual phenomena. Prolapse of the mitral valve, a congenital cardiac abnormality, is associated with a similar history. Fibromuscular hyperplasia is a disease occurring in young females. In these patients, proliferation of the medial muscular coats of medial-sized blood vessels occurs, causing carotid artery, renal artery, and vertebral artery stenosis. Migraine is an occasional cause of unilateral visual loss. Some patients with migraine have retinal manifestations presumed to be secondary to the vasospasm in the retinal vessels, and this may be substantiated by the presence of edema in the retina. It may occur bilaterally or unilaterally in patients with asymmetric disc edema due to increased intracranial pressure or Gantt cell arteritis. Venous stasis retinopathy may also present in this way and consist of microaneurysm, small punctate hemorrhage, and patches of neovascularization. The symptoms of visual obscuration originate from ischemia and resultant anoxia, and its presence indicates either occlusion or severe stenosis of the internal carotid artery. Ischemic orbital pain may be produced by anoxia, which is lessened by lying down. In some cases, retinal emboli in the form of white plugs, that is, fibrin platelet aggregates, may be seen. So now, come to the part of treatment of the transient loss of vision. In patients with cardiac force, treatment is anticoagulation and proper management of the underlying cardiac cause. Internal carotid artery stenosis may be managed with antiplatelet therapy. Management of systemic risk factors, carotid endarterectomy or stenting if indicated. Treatment with aspirin or pacentine may reduce the symptoms due to platelet emboli. Thank you for watching. Stay tuned for more updates and don't forget to like, share and subscribe. Please do remember to check your vision yearly and see the world clearly.